I know, I'm going to introduce you.
Okay.
But yes, we should call you. So we'll start again.
Madam Chair, we are live now.
Okay, so it is 10:03. I will call this meeting to order. Good morning, everyone. Welcome to the Board of Health meeting for Friday, May the 28th. Connie, please take the roll call.
Sue Patterson.
Present.
Brian Milne.
Present.
Brian O'Leary.
Present.
Chris Peabody.
Present.
Mitch Tulin.
Present.
Selwyn Hicks. Helen Claire Tingley.
She will join us when she's available.
Alan Barfoot.
Present.
Nick Saunders. Janice Jackson.
Present.
Thank you, Connie. We do have quorum. Are there any amendments to the agenda? Seeing none, I will ask for a mover and seconder for the approval of the agenda. Alan and Brian Millen, all in favor? Just raise your hand. Thank you. That is carried. Does anyone have a disclosure of pecuniary interest? Of course, if one should arise during the meeting, you may declare it then. Item 5 on the agenda is the Grey Bruce Board of Health appointment. And I would like to welcome, it is my pleasure to welcome Bruce County Warden Janice Jackson and Mayor of South Bruce Peninsula. We are pleased you have been appointed to the board, and I know you bring knowledge, skills, and experience with you, which will benefit the board and all residents of Bruce and Grey County. So welcome, Janice.
Thank you, Chair Patterson. I'm happy to be here. Thank you very much.
Good, thank you. All right, so item 6 is elections. And as the position of vice chair is vacant, we need to elect a member to hold that position. So before we start, I just want to go over the election procedures. First, I will ask for nominations for vice chair. Nominations shall be called 3 times and will only require a mover. Nominations do not need a seconder, as every board member has a right to make a nomination and therefore does not need another member to legitimize it with a seconder. The closing of nominations shall require both a mover and seconder. Each member nominated shall be asked to accept the nomination. And if there is only one nominee, the individual shall be declared into the position by acclamation, and no motion is required. If there is more than one nominee, our board policy 5-514 states that a vote will be taken by secret ballot. To adhere to that procedure, we will need to send our vote to Erin Maneri at e.maneri@publichealthgraybruce.on.ca. The policy also states that the positions of board chair and vice chair are selected based on a rotation between Bruce County and Grey County. As I represent Grey County, the vice chair should be represented by a member of Bruce County. So I will now open the floor for nominations. So this is the first call. Brian O'Leary.
Thank you, Madam Chair. I think with the fact that he's now a Bruce County resident and his experience with the board, I would nominate Ellen Barfoot.
Thank you. Second call for nominations, Janice.
I'll nominate Chris Peabody.
Thank you. This is the third and final call for nominations. Third and final call. So I will ask that nominations be closed. I need a mover and seconder. Brian Millen and Mitch Tulin, all in favor. That is carried. So we do have an election, and I will ask that you send an email to Erin. I believe it should just pop up on your screen from your emails, and just put the name in the body of the email. And there are 8 people 7 people present.
Oh.
So Connie, I will ask that you make sure everyone is able to reach you by email. Everybody clear on that? You're all right, Chris, or not?
Well, I didn't get an email.
I didn't get an email either.
No, you're going to send an email to Aaron
Oh,
and type in the name of the person you are voting for. There's nothing in our policy that ends up explains if we have a tie.
Duel at dawn.
Madam Chair, just to let you know, Ward and Hicks joined the meeting, and I wonder, for procedural point of view, if the nominees need to accept the nomination first.
Yes, we can ask. Will we? Hello, Selwyn.
Hi, good morning. I apologize. I had some technical difficulties, power outage.
Okay, so we're right in the middle of our election of vice chair, and there's been 2 people nominated. So I guess we can determine whether we actually do need an election by asking if you accept the nomination. And that'll solve the problem if we, with the emails. So Alan, as you were nominated first, will you accept?
I'd like to thank my nominator, and yes, I'll let my name stand.
Thank you. Chris?
Yes, Chair Patterson.
So Selwyn, what we're doing is sending an email to Aaron, and just in the body of the email, type in the name of who you want to elect as vice chair, either Alan Barfoot or Chris Peabody.
Okay.
And then Connie, you can let us know when you have all the emails.
Oops, sorry. I was in text messages.
So now we wait. If it was a paper ballot, we'd have a scrutineer.
So Chris, I'm surprised that you have power.
So when I'm up at my cottage for my 23-hour maintenance visit to cut the lawn. I had a bunch of broken lawn equipment, had it fixed on the week and had to bring it up. Cut the lawn last night, and so I was telling everybody didn't think the fireplace would work. So
Yeah.
you wouldn't believe it. I didn't have any firewood ready. I'm having to burn some flooring that I had installed, some scrap flooring. Keep warm here.
We have results, Madam Chair.
Thank you, Dr. Era. Connie, will you announce the results?
Chair Patterson, we have a tie.
Oh,
Madam Chair, I would suggest maybe running the election later in the meeting. If Helen Claire joined, that will make the number odd with no potential tie.
Right. Okay. Good suggestion. Thank you. All right, we'll move on. Item 7 is the recognition, and we have retirement acknowledgements. So, Dr. Era.
Madam Chair, there are 2 retirements. The first one, I'm just going to turn it to Drew, since the retirees sent a letter of thanks and they're going to join in a different meeting. They have a conflict with today's meeting. So, Drew.
Thank you. Through you, Madam Chair. This is with respect to Lee Fawcett. There was a lot of wonderful people working in public health, but it's as is often the case in any profession, there's 1 or 2 that stand out as being someone special. And today I'm honored to be able to acknowledge one of those as the retirement of one of those people, public health nurse Lee Fawcett. And no matter the situation, Lee steadfastly maintained a positive outlook, always kind, always generous. She was always willing to do whatever it takes to get a job done, a situation resolved, or provide assistance to those in need. And she always had a joke at the ready, and they were always corny. And her laugh was loud and infectious. She's both admired and respected, and I dare say loved by those who worked with her, myself included. Lee's unable to join with us today, but may be available at a future time. But in a note to the board, Lee writes, please convey my heartfelt thanks to the Board of Health and Dr. Era for the lovely plaque and generous monetary gift acknowledging my years of service at the health unit. Wow, very unexpected and gracious. Public health has been monumental throughout SARS, H1N1, and now COVID. Dr. Era is doing a great job of leading everyone in this journey. It is history in the making. Take care until we meet again. And as appropriate for Lee to say, big virtual hugs going out to one and all. Sincerely, Lee Fawcett.
Thank you, Drew. That was very well said, your introduction, and we extend, on behalf of the board, we extend our sincere congratulations.
Madam Chair, I would echo everything Drew said about Lee, and I look forward to her attending next meeting and or future meeting, and I would definitely add to that recognition. And the second recognition goes to former Director of Operations, Susan Schuler, and she's with us now. I'm just gonna join the head of the head of the table with Susan. Susan, before joining the health unit, was a team leader with Grey Bruce branch of Victorian Order of Nurses, and following that, she spent time as nursing manager for a retirement firm overseeing 5 homes in the region. Sue was hired 29 years ago as a permanent full-time public health nurse on June 1st, 1992, for what was then the Bruce Grey Own Sound Health Unit. Our organization evolved over the years, and Susan has been involved in every juncture of it. At the time, she was married to her husband, Brian, and she still is. And the way it's written, it could be misleading. They had a 2-year-old daughter, Caitlin, at the time. Initially, Sue worked in a family health program, then transitioned to part-time position in sexual health. In 1994, her son, Stephen, was born, and she continued part-time during maternity leave. In 1998, she returned to full-time with the health unit as the Heart Health Project Coordinator, a program that evolved in other programs at this point. In 2001, Sue joined the management team, taking supervision of the family health program. 3 years later, Sue transitioned to become manager of the vaccine preventable disease and sexual health program. During this time, Sue was seconded to assist in Toronto Public Health in the management of SARS. Shortly after SARS, Sue became the manager of infectious disease team, a position she held for several years. The next transition saw her become the manager of Healthy Baby, Healthy Children program, where she also oversaw the implementation of the infant speech and language program when it was brought into the health unit. In 2019, she was appointed as interim director of operations, which oversees all the programs in the health unit. And 1 year later, she held the position as permanent. She was director of operations until she retired a month ago. Clearly, a long and varied career in public health. Sue prepared for retirement, establishing real estate brokerage with her husband, Brian, and obtaining a real estate license as well as broker status. She's also opening a home decor retail store with her daughter, Caitlin. So I've had many colleagues who retired, and it really, I feel emotional anytime I remember that Sue retired. She was the only director of programs, of all programs, when she held the interim director, and her taking the lead on that position comes from the fact that she brings trust and stability, and her leadership style would allow us to heal as an organization. Historically, there were multiple directors in the organization, and she took care of that position on her own. And one example of her strength in bringing stability is the 2019 proposal to have a 10% budget cut to our organization. We all as a team bounded together in negotiation with our unions. Then, according to the Ministry of Labor, we had the first collective agreement in the history of Ontario with zero increase to health unit collective agreement. That is mainly due to Susan's work and leadership and bringing the whole team together. Susan has a sense of humor combined with confidence, and it comes very clear to me that the different junctures where she would say, do you have 5 minutes? I would, at that time, I have 80% confidence that there is something that fell apart in one of the programs, and Susan is about to fix it. And it becomes 100% when she says the honest truth, to tell you the honest truth. And as always, she acknowledged the truth is always honest. She has a big smile. Then she lays down what the issue is and the different aspects of mitigating that issue. And there's always confidence in ensuring that everybody's whole in that juncture or in that recovery. In the first training session we had together in 2017, there was a question about, if you write a book about yourself, what is the title? And Susan's answer, I remember it clearly. I have really good memory to almost everything. She said, Big Sister, Little Mom.
Yeah, I did.
Yes. And since then, I've seen it over and over, and I felt she's been the big sister for the whole team and myself as well. She crowned her career and retirement with finishing a pandemic of the highest caliber. And I already miss Susan, and I know the team does. Thank you.
Thank you, Dr. Era. Just a few reflections. I won't labor this too much, but I do want to thank the board and the senior management team and all the health unit for all the support. My mom and I talked on the weekend, and I don't think Dr. Era knows this, but we graduated together. We did our first diploma program, and we didn't do the whole thing together, but we did the last year, and we actually walked across the stage together and got our diploma. So her and I were reflecting, because that's 40 years ago next month. So I was 21, and I know how old I am. Anyway, that's all good. So we were talking about that, and I got off the phone and I thought, okay, I've been a nurse for 40 years. I've been at the health unit for 29. So the math says that's 3/4 of my career was here at this agency. And when I was 21 and I thought about, becoming a nurse and what that was going to look like, I never in any way imagined it would be such a great career. I've had, as Dr. Era said, many opportunities. I've done different programs with different people. And when we're doing interviews, we've hired a lot of people over the last year or so. And Sarah Ellis, I don't know if she's listening today, but people would ask me, why have you stayed at one organization for so long? It was kind of one of those questions, like, really, like, what is that all about? And I always said, I love the flexibility, because there's so many different things you can learn. And I would move from program to program as opportunities presented, and I would bring what I learned from that past program into the new program, meet new people, learn new things, and that really kept me motivated, and I love that. And it was great, and so I would say flexibility. But yesterday, my mom says to me, she says to everybody, you know, if you need to hear something, if you're listening, you will hear it. And yesterday I met a gentleman. I was volunteering at the clinic for COVID here in Owen Sound. And I was talking to another retiree, and he said to me, so what did you retire from? And I said, well, actually from the health unit. And he said, oh, well, you must be very proud of these clinics. They're great. And he's volunteered several of them. And I said, yes, I am very proud. And he said, well, what position did you retire from? And I, paused a second. I said, well, actually I was the director of operations. And he didn't know I had a big smile on my face because I had a mask on and I had a shield on and all those things. And I could tell by the look in his face, it was like, wow, good for you. I was just really proud. So I realized it wasn't just the flexibility, it's what public health stands for. And I've always really been very honored to be a part of that. And I've always been very proud to say that I was part of public health. But I do have to thank Dr. Era, because he kind of saw something in me that I probably didn't recognize myself as much as I maybe could have. And he's the reason I became a director and took that opportunity. And so I had that really great senior management team that were very supportive. We became a really good team. I miss the whole thing, but I do miss that team. And we had a relationship that was, I would never have guessed I would have that relationship with public health, medical officer of health, and I really appreciate that. And I just want to say thank you, and I couldn't have had a better career. And my daughter, last night we were talking about me coming here today, and she said, "But Mom, it's not done. That's just, like you're it's culminated. Now you're in the next stage." So she's keeping me very busy with our store, and we're doing curbside, and that's good. And Brian and I are doing some sales in real estate, so that's good. And I'm not waking up to an alarm clock every morning, and that's really good. So anyway, thank you very much, and thank you again for the gift that I received. It was very nice. I have a mantle clock and a monetary gift, but I haven't decided how I'm going to spend it. But I'm waiting until pandemic is over, so I have more options, because they're kind of limited right now. So anyway, thank you very much, and thank you for all your support and encouragement.
Thank you, Susan. And we definitely have friendship, not just relationship. And I would have given you a
virtual
hug if it wasn't for COVID.
Virtual hugs, like Lisa. Thank you.
So, Susan, on behalf of the board, thank you for your many, many years of dedicated service. You've been invaluable to the health unit, and we wish you all the best and hope you enjoy a happy, healthy, and well-deserved retirement. Congratulations.
Thank you very much.
Thank you, Susan.
Yeah, thank you. Okay, moving on with the agenda, we have adoption of minutes, and we have 5 sets of minutes, and I need motions for each one. I can't do them all together. So the first one is the Board of Health minutes from Friday, April 23rd. I need a mover, Brian O'Leary. Seconder is Alan Barfoot. All in favor? That's carried. If there's any discussion for these minutes, please speak up. The Board of Health special meeting from Wednesday, April 28th, moved by Brian Millen and Selwyn Hicks. All in favor? Carried. Thank you. The Board of Health executive meeting from May the 7th, moved by Mitch Tulin and Chris Peabody. All in favor? Carried. Thank you. Board of Health executive meeting from May the 10th, moved by Alan and Brian Millen. Seconds. All in favor? Carried. Sorry, that was Brian O'Leary. Connie will correct that. Thank you.
I've been called worse.
It was the smile on Brian's face that caught me. So Board of Health special meeting minutes from May the 12th. I believe this is the last one. Moved by Brian Millen, seconded by Chris Peabody. All in favor? Carried. Thank you. All right, so now we're moving on to delegations. And let me just get my papers ready here. So, there we go. So before we start, I want to share the rules for I want to share the rules for deputations in Board of Health Policy 3-307. So each deputation will be allowed a maximum of 10 minutes. However, our website states that delegations are allowed a maximum of 15 minutes. So we will allow the deputation to present for 15 minutes, and 3 individuals may speak if they wish to do so. Policy 3-307 also states the board shall render its decision in each case after deputations have been heard at its earliest convenience. Our first deputation is Ms. Kathy Moore-Coburn, Ms. Melissa Conwalker, and Mr. John Tamming. Welcome, and you may begin.
Good morning, everyone. It's Melissa Conwalker, and I'm going to be starting the delegation this morning. John Tamming and Ryan Gregg had prior commitments, and they're not able to be here today. They've asked me to pass on the message that they're still committed to the process of seeking the answers to the questions posed in our original letter. And Kathy Moore-Coburn is here in attendance, and she will be addressing the board following my presentation. Now I'd like to take a couple of minutes to explain my why. Why did I sign the letter, and why am I here today? I would like to start with a few words of thanks. Thank you first to Dr. Era and the team at the Grey Bruce Health Unit for all of the time and effort that you put in to get us through this pandemic. That needs to be said. In no way was that ever taken for granted or meant to be diminished by the questions we posed. Thank you also to the members of the board for having made the choice to put your name forward for municipal council. It's a challenging position, and more so in these unprecedented times. I believe that we all do so in hopes of making a positive difference in our communities, and we are all on the same team. Initially, I signed the letter because the amount of money that Dr. Era received was both an anomaly and a travesty. My career in the field of social services was publicly funded. How organizations use taxpayers' money to serve the public is important to me. As the stories of the untenable conditions at the health unit overwhelmed my inbox, my resolve to see our questions answered became more about the employees that we are counting on to get us through this pandemic. I hear from Dr. Era and the board about the high-functioning team and the successes at the health unit. The loss of 17 employees under Dr. Era's tenure and the stories from the frontline staff paint a far different picture. We've heard from the people that Dr. Era reports to. He controls that narrative. I can't help but wonder why we haven't heard from anyone who reports to him who has stepped forward in his defense. In listening to Dr. Era's presentation to the municipal leaders about reopening last Thursday, I was struck by the content. His talk had very little to do with reopening, and again, he used a public forum to defend his position. Dr. Era asked us to take home the message of patience, trust, and kindness. I feel the public has been patient, waiting for answers for legitimate questions. We trust that our tax-funded systems operate with transparency, equity, and efficiency. I hear repeatedly that the health unit has a strong team, but I wonder, how is that being measured? Low case numbers or a low death rate in our rural region is not a direct indication that the team is functioning well or that the workplace environment is healthy. I trust that the staff who have shared their stories are telling the truth. I am concerned that they do so anonymously in fear of retribution from their leader. That is not trust. And finally, this point is for Dr. Era and anyone else who has made this a personal issue. I agree with the sentiment Dr. Era shared on the Zoom meeting last week about us all being human and fallible. Dr. Era's final message about kindness is particularly challenging. I was taught to apologize when I've done something wrong or I've spoken in anger. There have been many hurtful things that have been said that have served to deflect attention from the genuine issues. That needs to stop. I think a good place to start is for Dr. Era to apologize for his flamethrower remarks. They were not kind. I will now move on to the first part of our presentation. We present today and follow up to our letter submitted to this board in March. In the original delegation notes that we submitted on May 20th, we made note that our letter had not yet been published as part of the board's documentation and as a matter of public record. Nor had we received any response to the question we posed to the board in our original letter. Yesterday, after waiting almost 10 weeks and with less than 24 hours prior to this delegation, we did receive a 12-page response. In general, the original letter outlined several areas of concerns, including the amount of overtime pay Dr. Eyre received for 2020, making him the highest paid medical officer of health in Ontario, and the staggering loss of experienced experts in upper management and senior leadership over the past couple of years. Since the writing of that letter, we've been inundated with comments from Grey Bruce residents, including former and current health unit employees. Their concerns point to a dysfunction within the health unit. And so understandably, our concern has grown. At this point, I'd like to hand the presentation over to Kathy to share where we are today. Thank you.
Thank you, Melissa. And thank you to the board for allowing us to present today. So with all of this in mind, and despite what we've heard from the Board of Health to date, we continue to ask that these concerns be addressed, and furthermore, to be addressed publicly. We need a highly functioning public health unit. And as ratepayers in Grey Bruce, we deserve accountability and transparency. And so once again, we're asking that the board implement the following. Firstly, a complete and independent financial audit. In addition to that, we would like to know how the Board of Health is monitoring, tracking, and approving the Medical Officer of Health's 2021 overtime pay. Secondly, we ask for an independent third-party human resources and management review. This review will only serve everyone's best interests. I really see no downside to facilitating that review. All organizations need that kind of check-in every once in a while, and certainly the health unit does as well. And for that process, it's crucial to ensure that there will be no retaliation against health unit staff, current and former, who participate in that review. And again, we ask that that report be made public. Folks, you are the custodians of our tax dollars. You represent us, the citizens of Grey Bruce. And so we're asking for effective oversight. We leave these issues in your hands to resolve as our Board of Health. Thank you.
So can I ask, is that the end of your presentation? So thank you very much for your presentation and sharing your concerns and questions. The board will make a decision and respond accordingly. Our second delegation today is Ms. Micheline Mann. And before you begin your presentation, it has been noted that the health unit's logo has been included on your petition. The logo is an original artistic work that is protected by copyright. That copyright gives the owner the exclusive right to reproduce the logo in whole or in substantial part. By using the logo on the petition without permission, you are infringing the copyright. Ensuring that the logo is not used without permission will help all to avoid creating confusion with respect to what has and what has not been endorsed by the board. We are sure that is something that everyone wants to do, especially considering the backdrop of the current pandemic. In that regard, your cooperation is appreciated, and I ask that you remove the Grey Bruce Public Health logo from your petition. And along that line, I also want to point out that the petition states a loss of 17 high-level staff since 2019. This number is incorrect and vastly different from our HR record. Similarly to the first deputation, you will be allowed a maximum of 15 minutes to present your information, and the board will respond at its earliest convenience. Welcome, and you may begin. Ms. Mann, you're muted.
Yep, I got it.
Good.
Okay. Good morning. I would like to start by thanking Mayor Chris Peabody for his kind invitation to enter our change.org petition into the public record at today's meeting. I'd also like to welcome Mayor Janice Jackson to the Board of Health. Ms. Jackson, I have no doubt that you will be a welcome influence. My purpose in appearing before the Board of Health today is to enter into the public record the concerns of over 1,400 Grey Bruce residents regarding the urgent need for an external review of our beleaguered health unit. Our concerns are not to be misconstrued with anything COVID related. Our concerns are coincidental to COVID, and we do not want the fact of COVID to be used to detract from issues which are long-term and embedded with health unit management in general and with board transparency and accountability specifically. Allow me now to refer to the change.org petition, which asks for a publicly reported external review of the health unit, and this is the reason I present myself to the board today. This petition was implemented on Wednesday, April 28th, 2021, and gathered 300 signatures by noon of that same day, and another 400 signatures within 24 hours. We currently stand at 1,480 signatures. This is, in fact, a large number when one stops to consider that many of you have your elected seats by the value of several hundred less votes. The petition became necessary as you, the board, were not forthcoming with any form of explanation or engagement regarding Mr. Era's gross overtime wages, and there were no answers regarding the loss of the over 17 high-level health unit staff. I understand that the board was able to address the issues of our petition and the councillors' questions yesterday, which is a full 2 months after the questions were asked. If the answers to the public's questions are nothing out of the ordinary, then it begs the question why it took 8 weeks to provide answers. Nevertheless, the time for answers from the board has passed, and now we look to professional auditors to help the public and the health unit staff, our frontline workers. As important stakeholders in our public health system, we, the taxpayers, ask that you, trustees of our tax dollars and of our public health, pay heed to our request. In the words of one of the many petition signatories, quote, "Public health conducts vital work in our communities, and the staff deserve a supportive and respectful work environment, and the public deserves transparency and accountability." And now I would like to have my slide presentation brought up so that all participants may follow along. And
there we go.
Very good. Okay, so the first slide here outlines the two main areas of concern covered by the petition, because since April 28th until just yesterday, as we all mentioned, the public had no answers. In particular, our concerns are the large overtime pay for the medical officer of health and all the questions surrounding the fact of that. And more importantly, we question the corporate culture of the health unit, including the above average turnover, which you will see on the slide is for public institutions is around 5% and Grey Bruce is at 11% and climbing. And the myriad personal accounts of threats, abuse, and temper tantrums employed by Mr. Era and his team. Moving along to the second slide, if I may. Great. We can see that the petition uncovered a breadth of public concerns as seen by the sheer number of signatories, of which over 80% were local residents. The breadth of public concern is evident in the engagement with the media and with social media. Since late March 2021, there have been over 28 items published on the topic of the MOH, the board itself, and the issues arising from both these parties. 28 published items is an average of 2 articles per week since late March. And we are able to count how many times the items have been opened and viewed. 45,000 times. 45,000 times. Health unit articles published in various social media venues were liked, which is a key indicator of interest, over 4,000 times. I would sum this slide up by saying there is a keen, persistent, and intelligent interest from our community regarding these issues. May I have the 3rd slide, please? May I have the 3rd slide scrolled up, please? I don't have control over this, do I? No.
No. Just be patient, it will work.
Okay, all right. Well, while we're waiting for it, I'll describe it to you.
There you go.
Oh, there it is. Okay. The 3rd slide here is a graph illustrating the breadth of concern. It's a handy chart that shows the trajectory of interest and interaction with the media items, which you can see that over a period of 1 month, which is at the bottom there and by the day, was sustained. Moving on to the 4th slide, please. We begin to see the depths of concerns of the taxpayers. Their concerns, based on the comments they took the time to write, fall into 7 categories. And I'm just going to read directly from the slide. So the most frequently mentioned concern was accountability and transparency. And we have attached actual comments from the petition. Quote, "It's a reasonable request to have the health unit held accountable for the questions asked." And quote, "If there's nothing to hide, this should be painless." Second of priority of concern was salary. Quote, "An investigation of such a large salary and how it was able to be attained through taxpayers' funds is warranted." 3, loss of staff. Quote, "I am concerned about qualified people losing their jobs." 4, board responsibility. Quote, "I want accountability from board members who represent me, a taxpayer." 5, staff environment. Quote, "Staff are working in a short staff situation. They struggle to keep up with the COVID crisis." 6, corruption was mentioned. Quote, "Convince me our MOH has not taken advantage of his position of power." And finally, management skill. Quote, "A great leader is one who can get work and great results through others, not someone who cannot retain staff." And then, thank you. The 5th slide is another visual aid to illustrate how many comments per topic were received, which is how we were able to prioritize the concerns based on the number of times each topic came up. And I'd like to take a moment to read some of the random comments. I actually have over 10 pages of comments, but I am only going to read some of them. Quote, "I have spent over 40 years on various boards in both the nonprofit sector and in private business. Without question, this situation requires a fully independent third-party review." Quote, "I feel public health in Grey Bruce needs accountability, from the salaries down to the reaction to the pandemic. The Board of Health, who signed off on Dr. Era's salary and his behavior, also need to be held accountable for their abuse of tax dollars." Quote, "The health unit board is out of control." Quote, "Salary employees do not receive overtime payment." Quote, "When you lose as many staff as our health unit has within 2 years, which I know from my own experiences, raises a big red flag. This tells me something is really wrong in this organization." Quote, "I want the truth, and I don't appreciate John Tamming being used as a scapegoat." Quote, "Not only is there a political clique in this area, but there also appears to be a health clique." Quote, "Because a review is never a bad thing." And the last 2, quote, "Dr. Ara is fleecing the public coffers during a pandemic. And this is an unacceptable abuse of the taxpayers' money. He had other options, delegate, hire, time in lieu, etc., but chose instead to be a pig at the trough. I didn't write them, I'm just reading them. All right, moving along then to our next slide, our final slide. Here we have reference to the original letter from the 4 councillors that until yesterday was not entered into the public record. So we have provided a link to the letter in its entirety here to correct that oversight. As well, we have a copy of the letter written by a frightened and dispirited staffer who laments the lack of viable avenues for support from the board or within the health unit itself. This person writes of some harrowing experiences and has at least 10 anonymous Me Too's who have agreed to this detailed account of the toxic work environment at the health unit. Included here as well is a link to a letter from one of our area's most respected doctors, Dr. Brendan Mulroy. Dr. Mulroy took the time to write and publish a letter also asking for questions or answers from the board. In summation, I would like to say that though the issues with which I and more than 1,400 other people are concerned are not COVID related, I will say that the issues of which we speak are concerned were happening prior to the pandemic, and they continue to happen. With regard to COVID itself, the fact is we in Grey Bruce have been fortunate in our low numbers as we live in a low risk area that lacks any high density manufacturing or workplaces. And we have a mostly rural and small spread out population. And finally, we've had widespread compliance from the Grey Bruce population itself. It is these factors and the hardworking frontline workers that have influenced our COVID success thus far, and we are grateful for our good fortune. I would like to impress upon the board that you have a duty to the public that goes beyond PR and spin. I would suggest that the us versus them tactics have to stop. I wish to remind the board that we actually are in this together. What harms one harms us all. So we, the Grey Bruce residents, say that the time for productive dialogue has long passed, and we ask again that the board follow best practices and hire a suitable audit and assessment firm in order that we may all learn and grow. And as we will all then know better, we can all surely do better. And I'd like to wrap up with just 2 questions, if I may. I would like to know where on the Grey Bruce Health Unit website can ratepayers view the manual that forms part of the orientation and training of staff and board members, and where on that same website can we view the board orientation materials presumably provided to board members to ensure they are fully aware of their duties? I will leave that with you. I thank you for your time today, and my presentation is complete.
Thank you, Ms. Mann. Thank you for sharing your presentation, the petition, and the questions. The board will make a decision and respond accordingly. Thank you.
Thanks.
Okay, moving on with our agenda, as that was the last deputation. We have item 10, which is correspondence and news releases. So I'll turn that over to Drew. And you are muted, Drew.
Sorry, again, through you, Madam Chair. Correspondence contains a number of items related to the issues immediately dealt with in the delegations, including the last item in the correspondence, a reply to the questions posed by the first delegation. We also have a considerable number of letters and municipal resolutions in support of the medical officer of health and the Grey Bruce Health Unit team. Additionally, correspondence from the Association of Local Public Health Agencies and Peterborough Board of Health with respect to extending the provincial stay-at-home order. And finally, the letter of thanks from Lee Fawcett, as read earlier. And you have the list, and I can respond to any inquiries with respect to individual items.
Thank you, Drew. Are there any comments or questions regarding the correspondence? Seeing none, Drew, if you want to continue with news releases, just a recap.
Pardon me. The
news releases.
Oh, pardon me. Yeah. Okay. Sorry. Pardon me. I was going in another direction there. I have the news releases in front of you. So there's a couple I would bring your attention to, particularly the first April 22nd, which was in fact a watershed moment acknowledging the severe nature of the situation. The community responded in kind by embracing public health's direction to stay at home. And that was a very heartwarming for people in public health to see that kind of engagement and response by the public. The item of April 26th is also of interest. That is the release of the Grey Bruce COVID-19 vaccine app developed in conjunction with Bruce Power and PX Innovation. Again, where public health is at the leading edge of the response to COVID-19. The May 6th media release identifies an innovative partnership with family health, paramedics, and public health in getting the COVID vaccine to those who are unable to leave their home for health reasons. So two-person teams bring the vaccine to those that need. May 10th also identifies a specially scheduled COVID-19 vaccine clinic for addressing the unique vaccination needs of immunocompromised and pregnant patients. They require certain windows of time when they can receive the vaccine, and we accommodate them with those special clinics. May 14th, I identify we were working with 2 restaurants in Owen Sound to manage cases of COVID-19, and just yesterday, those restaurants reopened, and we were working at the corporate level in managing the communication with respect to those items. And I think that is the key items I want to bring your attention to, and I can respond to inquiries on any of those others as well.
Thank you, Drew. Any comments or questions regarding the news releases? Seeing none, I will ask for a motion to accept the correspondence and news releases as presented. I need a mover and a seconder. I have Helen Claire and Mitch. All in favor? That is carried. Thank you. Item 11 is the Medical Officer of Health update. Dr. Era.
I'm sharing my screen, Madam Chair. I presume it is there now.
It is.
An update of 4 or 5 slide content about the situation with managing the pandemic and the rollout of the vaccine and next steps in the management of the emergency and beyond the emergency. So with the situation report, we are sitting at a very favorable position. The new cases per day is less than 5. This is from yesterday's report. We can see active cases to be 30 and high-risk active high-risk contacts 60. And this ratio of 2 contacts per case on average is very reassuring that the public is keeping their interaction to their household more or less. We have a low number of hospitalization. We're taking patients from other areas of the province, which is part of the effort that the hospital system provincially is doing, distributing the load of response or healthcare. Unfortunately, we have 5 deaths at this point. We hope to have this number not increasing going forward. Currently, no active outbreaks. This is as good as it gets for a 3rd wave, which I believe we already cleared. I believe going forward, based on the seasonality of this virus, like other pandemics, they come in seasons. So we look at the wave from the 2020 spring, and the peak was mid-April. We predicted the peak would be mid-April as well this year. And We hope going forward, this will be the end of this pandemic with more vaccines in arms. There are 3 variables that can change this prediction. One of them is COVID fatigue. It's cumulative. The ability of the public, all of us, to stay the course is reduced by time comparing to last year to this year. The second one is the vaccine distribution or supply nationally, internationally can be interrupted at any point. And the third one that's most important is the variables of concern. They are a wild card. If there is more variables or variables that the vaccine would not cover in the near future, that might increase the risk for more surges, but those are low probability events, and I am cautiously optimistic we have cleared the pandemic with enough vaccine in the summer. So this is from our dashboard on vaccines. We've reached 93,000 doses given in Grey Bruce, and there is the distribution. Sorry, I'm just looking at the Zoom meeting, the Zoom screen sharing. We see females are more vaccinated than males, and this is sometimes can be related to many variables or many fronts. One of it is we're opening special clinics for pregnant women. One of the reasons that could explain this. First dose versus second dose. There is more information on the next slide. I will go there. This is by age group, and we can see the 80 plus, we have 88% vaccinated, and the darker blue or the deep blue is a second dose. So these proportions will increase as we go forward. We started with the 80 plus, and that's why we have more of this group vaccinated. You would go to the 65 plus, I would say most people who want the vaccine have already got the vaccine. There will be a number of people who might change their opinion and want to get the vaccine, and that will continue as we go. The younger age groups are increasing by the day, and that's based on the provincial distribution. 85%, close to 60% of the eligible population in Grey Bruce have already received the first dose. Around 6% second dose, and that's consistent with the provincial direction and strategy to ensure first dose is provided to most people. 50% of the total population. The eligible population is 12 plus. Younger kids are not approved. The vaccine is not approved in younger age, less than 12. So current steps of emergency management. The schools, we have some work on 3 fronts. One, readiness to reopen immediately, and we have ensured this based on 3 main variables or 3 main fronts. 1, the epidemiology in the area is favorable. 2, the school team and school officials, school staff have optimal collaboration and working together with public health. They have the measures in place to open safely. And the third one, we provided the vaccine proactively in early April. We're starting early April. We finished by early May. And that would allow the staff to go back to working in schools with less anxiety about potential severe complications. Student vaccination, according to the provincial plan, we need to ensure that all students in schools are offered the vaccine 2 doses by September, and we're working with the schools and with the public to ensure this is happening. Planning for September 21st school opening. Again, this is contingency plan if the pandemic is not finished during the summer, and that is consistent with the provincial direction as well. Mass immunization system updates. We are supporting several jurisdictions in Ontario, different health units with knowledge sessions and operational planning to answer their questions on how to implement the system. There is support for Peel region that goes beyond the knowledge translation. We have a number of staff who were seconded to Peel to ensure they're operating the larger hub that Bruce Power put together there. And it will have the capacity to vaccinate 9,000 per day if it's working full capacity. It has been an honor and a privilege to be able to support a region like Peel that is one of the hottest spots in the country, I would say, at some point. Health officials from New Zealand reached out to us, and we supported with knowledge translation, and to the best of our assessment, the feedback we received from them on that session, they have been very grateful for sharing our time and the knowledge that we have in the health unit. Process mobile vaccination clinic for Meaford base, the military base, would receive civilians who would be trained during the summer, and they would not be eligible for the federal or for the vaccine, my understanding, that comes from the military. So it would be, at the end of the day, people who are residing in Grey Bruce during the training period, and we ensured that there is enough logistic to support vaccinating this group, the people who are serving the country. Chamber of Commerce rapid antigen screening. It's an initiative that the provincial government is supporting antigen testing for businesses, and the Chambers of Commerce across the province, across Grey Bruce, are interested in promoting this program. We have established connection with a couple of these chambers, but we're planning for a town hall to have all the chambers and the MPPs on a same meeting to provide information about the program, so they can make informed decision whether this is something that's going to help them or not. In general, in Grey Bruce, we see that the control over the pandemic, the contact tracing, and the very sufficient level of testing in Grey Bruce would make that program more useful for hotspots than low-risk areas like ours. And the final one is planning for reopening with the provincial announcement and the plan going forward. Our environmental health program, public health inspectors are getting ready to ensure our businesses and the different sectors are supported in approving their reopening plans. And the final slide, Madam Chair, is next step for emergency management, preparing for declaring emergency over. So it is definitely one of the phases. The recovery phase is one of the most complex parts of the emergency response, how to taper down. There will be declaration of emergency over during the summer. My prediction, it will be based on different variables that we communicate with the two counties and different municipalities, different jurisdiction, and we see how the provincial picture, the local picture is, and when that declaration is announced, we need to be ready already for the recovery phase. And I have been speaking with the team for 4 weeks now about the projected changes that we need to have to plan for transition for managers who are managing the emergency back to the COOP. The COOP stands for Continuity of Operation Plan, which is regular programs. I think of it as like a seesaw, where the emergency goes down, the programs that the health unit usually runs will go up and ramp. And this transition is described in the literature, and the management of the emergency is not an easy transition. It needs to be planned and intentional. Ministry consultation could resume. There are certain discussions among MOHs for that to happen, and we need to align our planning internally and locally with that potential eventuality or potential change that's external. Alpha resolution on public health leadership in opioid crisis. It is a direction from the board a few months ago that we would put forward a resolution for Alpha, which is the Association of Public Health Agencies in Ontario. And the resolution would encourage or call on Alpha to call on the public health sector and the different levels of government and partners that public health would be leading the opiate crisis response, similar in building, capitalizing on the momentum that we have created during the emergency response to COVID. So this resolution has been submitted and it is there for consideration by Alpha, and we will hear from them in the near future. Vision, these are the final 2 points, vision short-term and long-term. The short-term in 2019, when we were asked to prepare for modernization of public health, we looked at the Center of Excellence for Rural Public Health. Public health as a specialty is not very known as a function, is in the background where we do our work in silence, and the visibility of public health is less than optimal. And it's the nature of the business we do. If we do our work very appropriately, nobody would hear about us. It takes a Walkerton or SARS or COVID for people to realize public health. So our goal in 2019 was twofold: to ensure that we are visible as a sector, public health, and our projected line was 10 years to make public health a household discussion. And the second one is to brand our experience in Grey Bruce as a leader for rural public health in Ontario. And the pandemic, with all the hardship that it brings, it actually sped up those both steps, where public health is in the news 2-3 times a day. And the Center of Excellence in Grey Bruce has materialized on different fronts. Vision for long term, again, that's something I spoke about in 2018 and 19. It is something that we are not going to see in our lifetime, but I do believe in long-term planning, 200 years, 100 years, similar to building a cathedral in Europe in the Middle Ages, in the history. People who planned for cathedrals and laid the brick for the foundation never saw, and they knew they will never see the final product. And I do believe in a future that is healthier for all of us, for our kids and grandkids, and we are establishing this foundation. The short-term plan would definitely feed into the long-term plan. And that's my update, Madam Chair.
Thank you, Dr. Era. Are there any questions or comments for Dr. Era? Brian Millen?
Thank you, Madam Chair. Dr. Era, over the past week or two, the numbers, particularly the COVID-19 numbers, new cases, have certainly trended down and they've kind of leveled off. But certainly, particularly in Southgate, there seems to be a spike in the numbers. And I've had a number of inquiries from people wondering what's going on in Southgate, and I'm wondering if you have any insight into what is going on.
So in general, through you, Madam Chair, in general, our numbers are very low. So any variability, despite the fact that it is double or triple the regular number in other towns, it's still not significant enough to say there is difference or to make inference. Nevertheless, the proximity to hot spots in that area, the fact that people travel and work in hot areas, might explain part of that. But in general, I would not see that there is higher level of infection in any part of Grey Bruce based on the numbers that we've seen.
Very good. Thank you, sir.
Helen Clare?
Sorry about that. Great to see the numbers trending down. So wonderful on a daily basis because of the exceptional work done by the communications team, that as a community, we can watch that graph in our heads and look at the success. It is fantastic also that we are in a position to help other jurisdictions that have not managed to be as successful as we have to manage this awful pandemic. And it's also fantastic for all of us to be able to look forward to the potential of transitioning to an opening, even though it's not going to be simple. It's not going to be just turn on a switch and everything's great. We have seen that our high functioning health unit, under the exceptional leadership of Dr. Ara, has managed this so well. And I anticipate that we will continue, even as we move to the transition to reopening, to be leaders in the regions for the work that we're doing in public health. And finally, I would like to say, in response to Dr. Ara's presentation, there was a slide about the lack of understanding about what public health is. And coming out of this pandemic and some of the lack of understanding that we've seen, I think there's an opportunity to educate members of the public about what public health is, about how public health is managed in Ontario, that it's not a subset of the municipality, for example, the specific corporate governance that manages every level of public health, and how the enabling legislation takes care of concerns of members of the public. And I look forward to that added value for that communication piece. Thank you so much.
Thank you, Helen Claire. Any further, Alan?
Thanks, Madam Chair. Dr. Eyre, I've been kind of following on a graph, the vaccinations per day. And I noticed this past Wednesday was probably one of the biggest days we've had yet, where it was over 4,000. And on the weekly summary sheet that you send out, it looks like the trend has been to have basically one big vaccination day per week. Do you see that probably continuing on for the next number of weeks, that will be the type of format that will be used?
So it's based on, through you, Madam Chair, your observation is correct. It's based that larger number is usually on Wednesdays because it is the hub in Hanover. And based on the shipments that we receive from the province, our goal is to put vaccines in arms as soon as we can. So on Wednesdays, that's an opportunity of a few thousand to over 3,000 usually per day. There is benefit for this model. One of it is to give the vaccine as soon as we can. Second, to allow our staff to do the job in 1 day or 2 days and attend to the other functions of the health unit over the other days. And sometimes to attend to other modality of vaccine, whether it is in a reserve or providing second doses for first responders. I'm going to go granular here with an example. Firefighters, by definition of their work, they have to be within 15 minutes from the station at all times. So for them to travel over to the hub or to different clinics to get the vaccine, it might be over 15 minutes. In this case, we need to ensure mobile clinics go to the fire station and the vaccine is delivered there. So when you see the bulk of vaccines, even 1 day, it's just because of the efficiency of it. And over the other days of the week, there will be delivery to smaller numbers. However, it's not less work, rather a different type of work. Not sure if that answers the question or I missed the question there.
No, that certainly answers the question, and I think the summary is it's working, and please continue the same way, because we are gaining certainly substantial number of people vaccinated with that process. Thank you.
Okay, any other comments? Or Chris?
Yes, Dr. With the recent evidence that COVID is airborne in nature, as well as droplet-based, what changes to public health regulations will you be implementing?
Through you, Madam Chair, the report from Public Health Ontario reviewing the evidence came out last week, and although they added that transmission can happen airborne, without the ability from the literature to quantify how much, they did not change the public health measures to respond to it. So there hasn't been any changes to recommend, for example, N95. The transmission mainly remains droplet. There is some component of airborne, but again, the proportion of cases with airborne versus droplet has not been studied, but the indications from all the evidence that Public Health Ontario reviewed shows that there is no change in recommendation, or there is no significant change in recommendation.
There are significant outbreaks in apartment buildings in Hamilton, for example, Whitby, that show that is airborne. And so I have a lot of teachers quite concerned about the push to return to school, yet they don't know if the ventilation is correct in their classrooms. And so I wonder, if public health isn't going to address it, should I, as mayor, impose a bylaw on public institutions in Brockton to ensure proper ventilation?
Through you, Madam Chair, the evidence from Public Health Ontario did not recommend significant changes in ventilation. Good ventilation is good in general. And if we look at the situation from a different point of view, we have months of experience in schools in different level of ventilation, whether it's in the school or the school bus. The measures that we have in place, whether it's screening before coming to school, screening during the school, hand washing, physical distancing, using a mask, these measures combined have ensured the safety of students and workers in the school over the past months. Increasing the ventilation is practically, it's not going to add more safety. It has been already sufficiently safe. And we can add another variable right now that all school staff and we have received the first dose of the vaccine. And based on this picture, I would see that we do not need to focus on ventilation. And I would see the report from Public Health Ontario that's based on science, very accurate in not significantly pointing out to other variables that we need to manage.
Okay, Chris? Yeah. Janice?
Thank you. Thank you, Madam Chair. Dr. Era, I'm wondering, are we tracking, or is the province tracking, how many people are testing positive that have had one dose of the vaccine?
The province is definitely tracking that. We are tracking it, but our numbers, again, are too low to infer. From the provincial and the national data, the number of people who would have severe consequences of COVID after receiving the vaccine for 14 days is very negligible, close to 0.06%. So that is severe disease after getting the vaccine 15 days and after. Before getting the vaccine or right after getting the vaccine, of course, the immunity is still building. So the odds of protection is less, but it is not never zero. As you know, the vaccine with 2 doses is 95% effective. Does that answer the question? I can add to it if need be.
Yep, somewhat. So what is the percentage after the first dose? It seems to fluctuate a little bit as we gain more knowledge.
Yeah, I can get the exact number for infection. The number I mentioned is severe disease after first dose, 15 days or more, which is 0.06%.
Okay, thank you. Thank you, Madam Chair.
Okay, thanks, Janice. Any other comments? Selwyn?
Thank you, Madam Chair. Dr. Era, I'm asking you to hold the crystal ball a little bit here, perhaps, but 2 questions, both related to children. One, is there any sort of update on where things are at in terms of vaccination for children less than 12 years of age? And second question, is there a good likelihood that children 12 to 18 will have both shots by the start of school in September.
So through you, Madam Chair, the second question is straightforward. We will offer to all kids 12 and above 2 doses before the start of the school in September. That's a provincial plan, and we have the capacity to do this as soon as we get enough vaccines, and the plan would include getting this vaccine. The first part, 12 or less, that would be depending on the NACI's recommendation, the National Advisory Committee for Immunization. Usually the studies for approving a vaccine would take a year, like we saw in 2020. However, approving the vaccine usually exclude vulnerable population, pregnant women and children usually excluded from these trials. Then there will be subsequent studies to ensure the safety and efficacy. And those studies are called bridging studies. They're not full-blown clinical trials of 1 year or more. Rather, they are just comparison with the level of immunity and the level of safety. And usually takes a few months. And that's what we've seen with increasing the availability to 12 to 17. And probably we'll see this over the coming months as well, after there is more studies or more data that comes from this age group, 12 to 17. My best prediction, by the end of the year, we would have that completed.
Thank you.
Okay, anything further? Okay, Dr. Era, if you want to continue on, modernization and then the opioid situation.
Thank you, Madam Chair. The public health modernization, it's a standing item. There has not been any communication from the ministry about resuming the consultation or not, but there has been a discussion among MHs and health units and different organizations about the potential of this proceeding. That's my only update on the item, Madam Chair.
Thank you.
The opiate situation, again, since our last meeting, there has not been much changes. We have the final data from the coroner data, 22 deaths in Grey Bruce related to opiate, which is an increase from last year, not as significant as it has been in other parts of the province where it was an increase by 60% in some areas. We continue to operate the core programs, and we are in the planning of recovery from COVID and ramping up the response for the response to opiate over the coming months. The resolution to Alpha is one cornerstone, I believe, if it is approved and advocated by Alpha, that would give us more energy or more leverage to proceed with good work in the long term.
Thank you. Any questions or Brian O'Leary?
Thanks, Madam Chair. Dr. Era, can you just clarify, did you say the increase in some parts of Ontario is 60% or 16?
66 in some stats.
Okay, thanks.
Helen Clare?
And through you, Madam Chair, if Dr. Era could clarify, I understand that 60% in other regions and that for us it's 22 deaths. What percentage year over year is that for Grey Bruce?
Sorry, Madam Chair, I said 60%. There is sometimes some areas doubling. I can provide more detailed information on this report. In our area, it went up from 16 in 2019 to 22 in 2020. Can do the math quickly if that's of interest. I would have to review these numbers, Madam Chair. Apologize, it's coming as 16% increase.
I think it's probably more like a third, but arithmetic is not my strong point either. But if it was 16, just going up 6 from 16, But good to know. Thank you so much.
No, you're right. It is about 30. Sorry, I'm doing it backward. 30%.
Right. Okay. That's it for comments and questions. So I do need a mover and seconder to accept the medical officer of health's update. Brian O'Leary and Alan, all in favor? That's carried. Thank you. So item 12 on the agenda is corporate services, and we have the financial report for March of this year. Matt.
Thank you, Madam Chair. Overall, we had, as we had budgeted, spent a fair bit of money. We are a little behind when it comes to the bottom line. We are behind in our budget by $867,000. That is to be expected until we receive the approval for the additional COVID funding. That mechanism is in place and it's underway. We are expecting to go through an initial process in June and July, from which some part of that funding will then start to flow. We'll also need to report that squaring up 2020, we had put in for just over $1 million of additional money spent on the COVID response and support. We initially received a $250,000 approval, and they've made up the difference since, which is $756, both the approval and the receipt of that money. In terms of our ongoing COVID-19 response, both from a case and contact management and vaccination spot, we continue to we have continued to hire people, which shows up in the regular hours report at the end, as well as our overall response to COVID and overtime that we are experiencing, both anticipated and expected. We have also some capital items, but all as expected. We're just starting to ramp up the two dental projects that are underway. So far, there's nothing unusual to report in either one of those items. Open to questions.
Thank you, Matt. Any questions? Helen Claire?
Yes, through you, Madam Chair. It's more a comment. I had the opportunity to hear a keynote speech from Dr. Robin Hanley-Defoe, and she was comparing, she did a survey based on a vacation survey. And in April 2020, when people were asked about whether or not they're taking vacation, many people weren't, but the reason was because there was nowhere to go. The same question was asked this year for April 2021, and a huge proportion of the workforce, and the point being the workforce is burnt out, were declining vacations because of the amount of work that had to be done, and their fears that they weren't contributing to the work if they took time off. And in addition, that work would be left onto the team without them. And finally, that work would still be waiting for them when they came back. So my comment was just to acknowledge with great appreciation that the province has recognized that our health staff have to continue to work. They can't take time off in lieu because the work is so huge, so unrelenting. And to recognize that there is a financial cost for which the province is providing an amount that we can, just through a token, acknowledge and appreciate the work done by our staff at every level. And I just wanted to make that comment. Thank you, Madam Chair.
Thank you. Any other comments or questions? I need a motion to accept the financial report for March 2021. Yes.
Sorry, Madam Chair, I do have a question before you do that, just because I'm new to this and I'm just trying to. There's an $840,000. I'm sorry, I've got construction happening here. $840,000 deficit. So does that mean that that's to date? So we're expecting to be somewhere around $2 million by the end of the year. Is that what I'm reading?
Through you, Madam Chair, your extrapolation is not inaccurate, but we did actually forecast a roughly $4.7 million shortfall, and we've approached the government, the Ministry of Health, with just that number, and that's part of the approval process that is now underway.
What's the chance of not getting a top up, and if we're not going to be covered to the extent, do we have a contingency plan?
I think the first part is that we received correspondence from the ministry indicating that anything over and above our standard budget, which more or less is what it was back in 2019, the ministry would cover as long as it related to COVID. So the process that we have gone through, we have highlighted how much we're expecting to spend, and there's a formal approval process that happened in arrears for 2020. They're now actually doing it within the year. There's everything we asked for was paid. I've not heard of any other health unit not having what they've requested to be paid to be rejected. So I think it's a fairly low, if not zero, probability. And I would open it up if there's other comments.
Okay, thank you very much.
Helen Claire.
Thank you. Through you, Madam Chair. I'm pretty sure I asked a similar question last time, and I believe, Matt, you were quite positive through correspondence you'd received that we were on track to get those monies because so much of what we were reading is directly to do with COVID. So even though it's showing such a huge, negative flow, it's actually not likely to be that we are on track. Could you just expand on that a bit, Matt, for us?
Certainly. I think our overall effort, if we're tracking what we had both expended last year. So last year we had expended roughly $6 million of our $15 million budget on COVID, of which $1 million of that put us over our budget, and we were funded 100% of that by the ministry. This year that number has topped somewhere around $10.5 million that we would expect to spend on COVID of our normal $15 million budget. The additional piece, or the top up, actually our budget needs to expand to roughly $20 million, and that's what the 4.7 million increase is referencing. The likelihood of having that covered, based on the Minister of Health's written correspondence to the branch, to all health units, there's very little chance that any of that will not be covered. What they've asked for is a very specific, detailed, how do you plan to spend your 4.7 million over your standard budget? So we've given that detail to the ministry. They've had some questions, and all very accepting of our answers. No, oh my, what was that all about? It was fair enough. That makes sense. Where are you going to spend it? How are you going to spend it? And it's mostly time. There are some IT and some other soft costs that are involved, but it's mostly time for people. Does that answer your question?
Yeah, so in sum, what my understanding in the last meeting and in this meeting is that the oversight that is provided from the Ministry of Health, the template that is provided, we have checked all those financial boxes for them. And indeed, we are in an unprecedented time financially. We have incurred some expenses that are directly related to COVID. The Ministry of Health, through its oversight branch, has seen that and looked at through an informal review of what we're doing, and has actually covered expenses for 2020 that were incurred as a direct result of COVID, because they are in alignment from a corporate governance point of view in terms of what we should be spending. And we have reason to believe, based on that history, and based again on the oversight that is provided from the Ministry of Health, that we will again be given that life jacket, that financial life jacket to help us, because we are doing such good work in Grey Bruce, and because again we are checking the boxes with what is required of us. Is that a fair summary?
Eloquent and on point.
Okay.
Through you, Madam Chair, the process of approving the extraordinary funding for health unit has been clear since March 2020 that any expenses related to COVID will be approved. As soon as we submitted, it went through the review, it was approved. We submitted the second installment around New Year's for the rest of the 2020. We received it last month. It is a straightforward process. There is always financial risk. However, this is not one of them. I don't see it as risk. And then we asked the ministry, and I asked Matt specifically, to ensure that any submission that we send to the ministry is processed as fast as they can. And they have actually indicated that they will definitely approve parts of it early on, just to ensure everything's going to be approved within 2020. I see that the process from the ministry is straightforward and would allow us to respond to COVID financially with no worry about covering this extraordinary budget.
Right, good, thank you. All right, so we need a motion to approve the financial report for March of this year. I need a mover and seconder. Helen Claire and Selwyn, all in favor? That's carried, thank you. Item 13 is other business. So we have resolutions for consideration at the Alpha Annual General Meeting. Dr. Era, you were going to speak to this?
Certainly. So as I mentioned, we submitted the resolution for supporting the initiative that public health would lead the emergency similar for COVID response, similar to COVID, sorry, for opioid response, similar to COVID response that we had. The Alpha Annual General Meeting, just in terms of background for new members, it is one of the largest meetings related to public health functions in Ontario. And the resolution submitted there is usually voted on by health units. So a number of our board members, myself, will be attending the annual meeting, and there will be a list of resolutions there. We need to review between now and May 10th, I believe, the meeting. And on the meeting date, we can vote based on the presentation of these resolutions. My understanding at this point, there is only one resolution, and our resolution would be the second one going in when approved. It's just for information, this item, and the action will be in the meeting at the time.
Thank you. So, any questions or comments? All right, so at this point, we're going to take a step back on the agenda and do the election of the vice chair. Now that we have a full number for voting, actually an odd number, and that's all I'm going to say about that. So Helen Claire, I'm going to explain. We did have nominations. 2 people were nominated, Alan Barfoot and Chris Peabody. And our policy states that we, the positions of board chair and vice chair rotate. They're selected on a rotation basis, so that one is Bruce County and the other one is Grey County. So as I represent Grey, it's recommended that we have a Bruce County representative. So Alan Barfoot is from Bruce County and he has been nominated, and Chris Peabody is from Bruce County and he has been nominated. So they have both accepted the nominations, so we have an election. So how we're handling it is sending an email to Aaron's email address, which is e.maneri@publichealthgraybruce.on.ca. So in the body of your email, just type in who you would like to vote for, who you are voting for. And then Connie will tally it up and we'll see the results. I didn't want to open it up for nominations again because we've already had that motion and closed nominations, if that's fair. Brian Millen?
Madam Chair, are we all requested to vote again, or is this
Yes.
simply?
No, we're all requested to vote again.
Very
please.
good. Thank you. Just for clarification. Thank you.
Yes. So if everyone could send an email to Aaron's email address and just state who you are voting for. We'll see how this works again. Helen Claire?
Thank you, Madam Chair. I'm not sure if this is going to be useful to everybody else, but certainly as a new member, I would appreciate hearing a little statement from each of the candidates, if that is acceptable to you. Just a short summary as to what they feel that they would bring to this role again. I believe that Mr. Barfoot has recently done the role, and it would be helpful with these two candidates for me as a new person, if that's acceptable to you, Madam Chair. Thank you.
Yes, it is, and that's fair. And we will go alphabetically. So Alan?
Sure. Thanks, Madam Chair. I guess having retired from municipal politics has given me ample time now to be able to take on some additional committees and whatever. So I just thought by putting my name forward here, it gives me extra time that as vice chair, then I could participate in the additional meetings. Obviously, with the way things have gone this year, Board of Health has been more meetings than normal. And I can appreciate, having been an elected official, how many meetings there is. So I guess the summary is I've got lots of time on my hands to be able to do this. And as well as having been a past chair, I'm very familiar with how the processes worked and would just like to add my expertise to that.
Thank you, Alan. Chris?
Yes, as a Bruce County Councillor and the Mayor of Brockton, I have been extremely engaged in the fight against COVID, extremely supportive of public health measures that have been enacted. So I would bring to this position that passion and commitment I have to public health, and I've shown that through the COVID fight. And I have served, filled in there for Anne when she very unfortunately resigned. So I have been being a substitute chair, vice chair. So that's what I would bring to the role, Helen Claire.
Thank you, Chris. Okay, so if everyone could send an email to Aaron's address with the name of the individual you are voting for, we'll see how this works. And then Connie will let us know.
Madam Chair, while we're waiting, if I may just add the numbers just to be complete about that opiate fatalities in 2020 with the percentage. So the 22 death would add 27% increase in Grey Bruce. The report could be 23 as well, not 22, and that will be 31. In general, we have an increase roughly around 30% fatalities related to opiate.
Thank you. And just so everyone's aware, Alan, did you have a comment or? No? Just so everyone's aware, we do have an in-camera meeting once the election is complete, but I'd like to take at least a 5-minute, if not 10-minute break, and then we'll start the in-camera.
Ellen.
Was that Connie?
We're just tallying here, got the final vote in, so bear with me one moment.
Okay. Sometimes you hear things and you don't know if someone's speaking or not, so.
We do have a winner.
You need to announce it, yes.
So Alan Barfoot.
Okay, thank you. Alan Barfoot is declared the Grey Bruce Board of Health Vice Chair for 2021. Congratulations, Alan. And thank you, Chris, for putting your name forward and filling in for Vice Chair when it was needed. Okay, so we do, as I mentioned, we do have an in-camera meeting. So I would like a motion to go in camera in order to address matters pertaining to advice that is subject to solicitor-client privilege. So I need a mover and seconder for that. Helen Claire and I have Alan, all in favor.
Madam Chair, should we take a break first?
Yes, I just want to have that motion on the books. So so we are going to go into, we are in closed and we will come back in closed. So let's take a break and we'll come back at 12 o'clock unless you want to come back. And you'll let me know when the live stream is on.
Comes up and says meeting is now streaming live on.
We are live, Madam Chair.
We are live now. Thanks. All right, we are now in open session, returning from a closed meeting, and I declare we only discussed the items that were listed on the closed meeting agenda. 5 sets of in-camera meetings were adopted and direction subject to solicitor-client privilege was received. We have one further motion, and that is to adjourn the open meeting. I need a mover and seconder. I have Helen Claire and Selwyn, all in favor. Carried. Thank you very much, everyone.
Have a good weekend, all.
Good weekend, everyone.
Bye-bye.
Bye.
TTFN.